Hey, this is Dr. Jonathan Shepard speaking, and welcome to Ask the Doctors broadcast, sponsored by Hope Health Systems. I am your host, Jonathan Shepard, Chief Medical Director of Hope Health Systems. I am so glad to be coming to you all today on another Friday, and actually Saturday, where one of our guests is, but Friday here stateside. Friday evening. I'm so glad that you joined us. I hope that you are sharing this broadcast with your neighbors, with your friends. And thank you. Let me know that you are watching. As you see, I am masked up and I have this on for a reason. Thank you, Chris, for acknowledging and commenting. Uh, hey, how you doing, Angela? Thank you for coming on in. I want you to comment. Let us know that you're watching. Let us know how you're doing today. Hope that everyone has had a wonderful week and that you are staying safe. I hope that you have gotten vaccinated. And I hope that you're going to participate. We have a wonderful show. When I tell you today, this is groundbreaking for Ask the Doctors broadcast. We are literally across the globe today. We are in 4 different time zones. We're in 3 different countries, all at one time. And so don't miss what's going to take place today. Let somebody know it's time to log in to Ask the Doctors. I appreciate you all adjusting to the time. We normally will start at 6, but we're in a new season and we start at 7 o'clock today, Eastern Standard Time. And yeah, somebody's asking, why do you have the mask on? Oh, I was waiting for that. I was waiting for that. I have the mask on for a reason. Anybody who knows me knows I'm very strategic. Here in the United States, yesterday, the CDC, Centers for Disease Control, said that those who are vaccinated or fully vaccinated can not wear their mask. And then the governor of Maryland just decided today to lift the statewide mask mandate. And so many people out there today are confused. People are confused. People are anxious. People are in bewilderment because the CDC have been following such cautious guidelines up until yesterday. I've even read where people are commenting that how do you go from being cautious to throwing caution to the wind? Yeah, it is a little bit puzzling. I'm not here to make any bold statements beyond the one that I'm stating right now. And what I'm stating right now is that for those who are not vaccinated, you need to continue to wear your mask. Those who are vaccinated, I would definitely consider wearing a mask where there are going to be unvaccinated people. That's the point of what I'm trying to say, is that you have to be aware of your surroundings as we move forward. Even though we have the vaccines that are out, this is not the time to drop the ball in regards to vigilance and diligence to what we know in curbing the effects or the contraction of the coronavirus. I'm speaking like this because I am concerned that there are going to be people who are going to say, well, I don't have to wear a mask anymore, even when I'm in places where there are unvaccinated people. I would caution you, because as a fully vaccinated person, you can still carry the coronavirus. All right. I want that to be clear. The vaccine does not stop you from carrying the coronavirus. It has never done that. That's not even the intention of the vaccine. The vaccine is to curb the COVID-19 disease from that not occurring in your life. That's the purpose of the vaccine. And to curb deaths is not to stop you from contracting the coronavirus. I hope people really hear me and understand that. So why am I saying this so slowly? Because I want you to absorb it. What can happen is you can contract the coronavirus and still spread it to someone else because it is an aerosol. And with that said, if you have not been vaccinated, they can contract the virus and then, wow, it could be something deadly. I've told people, and I'm ending here, that I now have the highest number of patients on my caseload with the coronavirus, with COVID-19. You know, why would it wait 15 months after the pandemic starts for me to have the highest number now? Just letting me know that there has been some dropping of the vigilance. And so we want to make sure that we don't do that. So I had to come on with the mask on to let you know you're going to see me masked up still, and not just masked, double masked, and still have my Hope Health Systems mask. And we want to make sure that we are staying safe out there. Again, welcome. Oh, my Lord. Rhonda, Alicia Hayes is out there. How you doing, Dr. Harris, Dr. Marie Harris? Wonderful. Thank you for joining us. And we have some other people who are online. Please let me know that you are here. Yes. I'm going to bring on one of our guests. We're talking about the global impact of the COVID-19 pandemic. Yes. Oh, Missionary Vera is on. Oh, my Lord. Wonderful. We have people joining us from all over the globe today. So I don't say country, all over the globe. People are going to be joining us. And my first special guest is a person who I enjoy working with. She's had a tremendous impact. Oh, man, Jason Robin, back from high school, is watching. Thank you, man, for watching. And I see Patricia Courtner. Man, I need my glasses, don't I? The pandemic has gave me eye strain. And yes, from Detroit. Wonderful. Let me know where you're from. So this person I highly respect. She is a force to reckon with in her own right. And she is one who actually studies behavioral health as a counselor. And we have shared on numerous occasions, just professionally. I have tremendous respect for her family, for her husband, as they have been mentors to me, especially in this area that we're going to be discussing today regarding international missions work and the effect of the COVID-19 pandemic. So I want the Mrs. Elizabeth Rohn to come on in. How are you doing?
Doing great. God is good.
Yes, ma'am. And she's actually a pastor's wife. Her husband is a pastor there in Pomona, California. And he also serves as a jurisdictional prelate, which means he oversees the work of the church in the country of Brazil. So these are busy people. Tell the people a little bit about yourself. I just talked about your husband, but again, you are there to support him right by his side. Tell us a little bit about yourself. We want to know about you, First Lady. Yes.
So I'm a retired school teacher, and I have a master's of education from Azusa Pacific. My bachelor's was from Oral Roberts University, which is where I met my husband. And after my children were gone on to college and things, then I went back and got my master's in marriage and family therapy. Wow. And so I've always been an advocate for children, behaviorally challenged children during my many years of teaching. But now I still have adolescent clients that I'm dealing with. And in addition to being the wife of a bishop of Brazil and the wife of a medical doctor. So I have a lot surrounding me regarding this COVID situation. My daughter also happens to be a nurse practitioner. So we have a great deal of medical dialogue, not only how it affects us in the United States, but also in the nation of Brazil. We just are greatly concerned about how the saints in Brazil are being affected. And we've lost recently one of our auxiliary bishops, Bishop Paiva, to the COVID virus. And then right before that, one of our prominent pastors, Pastor Mariano. Right off the bat, we lost a very beloved translator, and she was a young woman who had just had a child, actually. And the list goes on. And so we are greatly impacted, especially since we are not able to go there physically and comfort the saints in Brazil. That makes it even more challenging for us. And then in addition to Brazil, so many other countries with whom we are connected. You may have seen India. We are very closely connected to Bishop Lawrence, and he has recently released a video alerting the saints to the urgent need that they are having in the nation of India surrounding this dreadful COVID. And so we are just, our hearts are heavy, and we have to remain, strengthened so that we can be a blessing to those that we serve.
Absolutely.
Now,
Wow.
locally in our church, we have gone back. My husband, like Dr. Shepard said, he pastors the Mount Sinai Church of God in Christ in Pomona, California. And we now, we went right before Easter. We began having in-person services, and we still have many of the saints who are afraid to come back to church. And even though we're following all of the guidelines, taking, all the precautionary measures, social distancing, sanitizing, taking temperatures, we still have saints who have yet to return. And now that they're saying no mask required, we're just waiting to see how this will affect our congregation, our community, because believe it or not, we have some of the saints that still do not want to get vaccinated. And they say that they are waiting to see some more long-term results, regardless of all of the conversations. Dr. Shepard was even with us on one of them when they talked about, how important the vaccine is. Covered it, you would have thought, from A to Z, but we still have some saints, some members who refuse to get vaccinated. So even though, the mask is not mandated, that still can create a problem because of those who refuse to get vaccinated. So we are just kind of trying to go with the flow of what the Lord will allow and how he would direct. And then, of course, we know that nationwide, and even in Brazil, we were talking with our women's department there. Domestic violence has been on the rise.
Wow.
Because of the pandemic and people being cramped in together that are used to kind of having some distance between themselves. Anxiety is on the rise. Suicide. You can see in the news how it is affecting our teenagers, our youth. And so we truly have a big job on our hands. Absolutely. And so I appreciate this time of dialogue because it is so essential. It is needed. So thank you, Dr. Shepard.
Absolutely. So you can see why I had to invite First Lady. I just call her First Lady Rome, but Mrs. Elizabeth Rome for those in our professional circles. But I tell you, this is a true missionary by all sense of the word, and educated, as I mentioned, a force to reckon with. And you just saw how she just systematically described what was happening in 4 different countries, really. United States of America, She described what was happening in Brazil. She described what was happening in India. And we're going to get to the Philippines. So that'll be the fourth one. And we have worked over there also. Wow. So we got people watching from the Philippines. We got people watching from Brazil. I think it's a good time to go ahead and bring in our guests. And so First Lady Rona is going to assist me in some of the dialogue and some of the moderation. We have worked together in going over. My first time going over in a mission trip was in 2008 to the Philippines. I will never forget it. I still have pictures. And let me tell you, it changed my life. And I tell you, the people of the Philippines have a special place in my heart. The COVID-19 pandemic has hit the Philippines. It's still the 25th out of the top 30, 25th country that has the highest number of coronavirus. I just checked that count before I came on live today. And so there is a person, his name is Bishop. He has a title of bishop in the church, but his first name is Pastor Avel Forto. I'm sorry, I messed that up. And so I want him to come on and tell us a little bit about who he is, and then we'll have our next guest. How you doing, sir?
Good morning. Great morning. Hello. Yes, Dr. Shepard. Thank you for having me in your program, and I just want to acknowledge First Lady Ron and even Dr. Shepard. They've been here in the Philippines helping Kojik through medical missions, to giving supplies in medicines to our pastors, members, and even to our native people.
That's right.
And we are so blessed that because of their hearts, that they really want to help, especially here in the third world country, where not all the Filipinos have the means to buy their own medicine. So it's really a big help for them to have those medicine. I could still remember those times, and still when I saw you, it's like it flashed back immediately.
Yes.
And first of all, I am Bishop Adel Forto Jr. I'm the jurisdictional bishop of J2, which comprises the Central Philippines, or what we call the Visayas Islands. And in 2001, I had my college degree as physical therapy. Actually, I tried to work out my working visa in US last 2005. But just to shorten the story, God spoke to me through a dream, and He's telling me that you need to go back. You need to help your parents to the work of God in the Philippines. And I promise you that I will never, ever forsake you in terms of financial status.
Wow.
So I decided, and I followed God's instructions. So from PT, from physical therapy, he put R on the end. So I'm a full-time pastor when I went back to the Philippines. And I had also my Master of Divinity in Asian Theological Seminary last 2011. And in 2013, I was ordained and consecrated as auxiliary bishop in J1. And for 6 years, I've been serving the jurisdiction with all my heart, supporting my parents, my dad. I just want to acknowledge my dad, and I believe he's watching now because I just shared this broadcast to our GC. We have a GC in Kojik, Philippine pastors. And I just want to welcome all our pastors, our missionaries in the Philippines. And of course, to our senior regional bishop, Bishop Abel Forto Sr. And in 2019, I was ordained and consecrated to be a jurisdictional bishop in Central Philippines, together with Bishop Joel Balindan of Northern Luzon. So I could say that we are all blessed despite of the pandemic that we are facing right now, because we are holding on the promises and the words of God that He will never ever forsake His people. Amen. Praise God.
It's good. Thank you. Thank you. Ma, you know, I want people to understand it is already Saturday morning in the Philippines.
Yes,
I,
yes, indeed.
I am just blown away when I think about that. It's almost like looking into time. So I'll leave that alone. So for those of you all concerned about if you're going to make it to tomorrow, Bishop Forto is already there. Right.
Hey,
So
that's
I'll leave it alone at that. This is not the time for my for the ministry part of what I do, but I tell you, it's all in me. So I'll leave that alone. But yeah, this is awesome. He's 12 hours ahead of us, you all. So it's already
yes.
7:23 in the morning on Saturday. So wonderful. Thank you. We're going to hear a little bit about how the pandemic has hit the Philippines. I want to bring on our next guest, who is a pastor, Pastor Aeneas Francisco. And my brother, how are you, sir?
Hello, Dr. Shepherd. I'm doing well by God's grace. Thank you for asking. How about you?
Oh, I'm doing good, man. I tell you, we have so many guests who have logged on and who are watching right now. And let me first also acknowledge those who will watch the replay. There's so many people who will go back and watch the replay. Um, I just want you to tell the people a little bit about what you do in Brazil, and then we're going to get into this discussion because people need to know what has happened. We have to make sure that we understand that it's not just about the United States of America. It's not about our little own
Yes.
personal issues. I'll start right there. Come on, describe what you do, my brother.
Well, first, I'm very thankful for the opportunity to share this platform with you tonight. And I'm grateful for the life of the First Lady of Brazil jurisdiction. May God bless her. She has done outstanding work here alongside her husband, Bishop Ron, to Bishop Forto, who I meet only in the convocations, and I'm missing convocations so much to meet all the people from Kojic around the world. And you, Dr. Shepard, we have worked together before, both in
Yes.
Brazil and Mozambique.
Yes.
I serve in the Church of God in Christ for about 20 years now, about 22 years. We started as the interpreter for this jurisdiction under the leadership of Bishop Samuel Moore. And then God began to prepare me for ministry. So I have been ordained in 2003 and served both in Rio de Janeiro and different cities of Sao Paulo, planting churches, Life Church of God in Christ, Emmanuel Church of God in Christ. And at this very moment, I'm living in the city of Sao Paulo. I have a publishing business that I serve Christian authors, both on theology
Oh, wow.
or even novels. And it happened that until 2 weeks ago, I was a pastor in a sabbatical. I took some time off to take care of myself, my mind, my soul, my family.
That's
But
right.
due to COVID, my sabbatical that would be extended to at least 1 year, it was necessary to cut it in half.
Right.
Mother Rome began talking about some of the losses we faced in Brazil. And among these losses, we lost Bishop Paiva and then Pastor Alexandre Mariano. And by God saw grace in me to step now into his place in the church he was pastoring, Mount Calvary Church of God in Christ. So that's what I'm doing at this point.
Gotcha. Wow. Wow. Yeah. And that's what I want to just highlight. Just some of the. And again, I know it's going to bring up some. Could bring up some sadness and things like that. But we do want
Yeah.
to honor and remember those who have succumbed to the illness. I was just looking again at the stats. Brazil is number 3, only behind India and the United States of America. So let me start there with you, Pastor Aeneas. You're the last person, but I want to start with a question with you. Tell us what has it been like living in Brazil in the middle of this pandemic?
Well, it has been, I would say, very difficult, especially because the Brazilian is a kind of people that is very warm. We hug everybody, we love everybody. And it's difficult for us to face this season without hugging. We
Wow.
just love to hug everybody. Everybody that accept our hug, we hugging and sharing and fellowshipping. And it has been very, very difficult for us. Um, especially in a specific thing when we go to bury our loved ones. In Brazil, generally, our funerals are very, very quick, but now it got even quicker. You know, someone passes, probably same day or next day they've been buried. The casket is fully closed. They are inside a bag. You cannot
Wow.
see the body of your loved one, and this has really impacted us in a way we never imagined before.
Wow. Wow. Yeah. We can speak to that, First Lady, as you know that even in the United States, we've been totally devastated by even within the church world. California
Yes.
has been hit very hard.
Yes.
Um, you know, you as again, First Lady, those who people come to you for comfort. They come to you because of the position you hold, but then also because of the profession you hold too.
Mhm.
I know it's been difficult. I don't know if you want to speak to that, just how people have struggled with that, um, not being able to be with their loved ones, even in death.
Yes. That's extremely difficult. And it's just such an overlap because before you can really help one family heal and kind of get through the grief process, another one has already passed. And
Wow.
so the overlap is so great. We're just kind of spread very thin, trying
Mm.
to help comfort so many at the same time.
Yeah. Yeah. Bishop Forto, tell us a little bit about what's been the scene there in the Philippines.
Yes, it's a good thing that you asked about the condition of Philippines during this pandemic. Actually, just to give you a quick information or the facts, we have 1.12 billion active cases as of yesterday, and we have 1.05 million recovered already, and we have 18,000, more than 80,000 deaths. And in my city, uh, actually, the city of Angeles, and I believe you've been here with Lady One and of course
Mhm.
Dr. Shepard, we have an active case of 70 78 active cases here in Angeles, and we have a total deaths of more than hundreds. But of course, speaking for a country which is this is the food that in a third world country, it's really difficult for us to face this pandemic. First is we don't really have that capacity or the the the, the amount for us to be able to recover, to buy some to build a facility that where could be hold those uh, people with COVID. When one of my friend who works in one of the public hospital here in Angeles, he just he just told me that some or most of them or that has a COVID-19 are just outside the emergency room. They could not hold them
Wow.
inside the emergency room. And even in private hospitals, they
Mm.
just build a temporary tank for them to hold those people with COVID-19, and you just cannot be administered right away in the emergency room because of lack of facilities. So that's one of the biggest problem that my country is facing, is that we don't really have enough facilities to hold those people with COVID-19, and that's uh, one of the reasons why it keeps on uh, contagion other people
Yeah.
in that certain area. So, but in my city, actually, just to inform you, only yesterday I was given my first shot of my vaccine,
Wow.
and it's AstraZeneca. But the vaccine was already it's are already here in the Philippines since January. and we've been waiting for almost 5 months for us to be able to be vaccinated. And the funny thing is, in my city, one of the way that you could be able to be vaccinated is for you to register online. Okay, for you to be able to be on the list on their priorities. And I was able to register for 3 weeks. I mean a month, and I'm under because we have a different priorities here in the Philippines. If you are a frontliner, you are in A1 category, so it means you'll be vaccinated first.
Okay.
If you're a senior citizen over 60, you're second, which is in A2 category. And in A3, those are with comorbidities, just like me. I have I've been I have a diabetes, and I've been doing my insulin for almost 4 years.
Wow.
So of course, but by God's grace, I'm still strong, you know.
Yes, sir.
And I just found out last week when I talked to one of my pastors, and he told me that he's been vaccinated a month ago. And I told him, how come? And he just told me, I knew someone in the city hall.
Yeah.
So that's the funny thing.
Yeah.
So if you don't know someone inside the
Sure.
city hall, you'll be left behind, you know. And I just asked him, can you just talk to that person if she could include me on the list for tomorrow. And
Wow.
after a few hours, someone called from the city hall and he just asked me, I will be included on tomorrow. What I'm trying to drive out is that there's still, you need to have someone inside for you to be able to be vaccinated. If not, you'll be waiting for so long, you know. That's one of the sad thing here in my country. There's still what we call red tag. If it's not about what you know, it's about whom you know for you to be able to get all the right of a citizen of that certain city. So right now, I was talking to my wife, and she was asking me if how do I feel. I just told her that I feel some numbness on my on my right arm, but I'm doing well, and I thank God for that opportunity that I was able to get my shot yesterday.
Wow. Man, you said so much, and I really want to follow up with that. Did you notice, First Lady Roan, that they have the AstraZeneca vaccine? Yeah, I took note of that. Now, go ahead.
Was that as a result of the stockpile of what was in the United States? I know at one point there was such a stockpile in America that we were sending, I thought, that particular vaccine to other countries. Is that how you all received it?
Actually, according to our national government, AstraZeneca was given an emergency use by the Department of Health here in the Philippines.
Okay.
Actually, for those vaccines that would be able to bring here in my country, they should be an approval from the Department of Health. They should need first to test it and so many process. But what we're trying to tell them, it was already tested with the country who made it, you know. And that's one of the reasons why the vaccine is they were not able being administered right away because of that process. Something like that.
Wow. Yeah, because it hasn't been approved here in the United States, and so we're waiting to figure out what is going to happen with that. There's a couple other vaccines here. At least there's two others. It's the AstraZeneca and it's the it starts with the N. I think it's Norvasc or something like that. I'm not pronouncing that name right. Right here in the United States, we have 3. So, Pastor, tell us what's going on with the vaccine down there in Brazil. Tell us a little. I've heard so much, even about the Russians trying to send down vaccine. I've even heard about that.
Yes, sir. We having struggle with the vaccination process. We have. I'm reading this right here. We have 4 kind of vaccines that are
Wow.
being made available here, but the logistics has been very complicated. We had CoronaVac, AstraZeneca, Pfizer, and Janssen.
Ah,
But so that you may have an idea, our bishop from the Philippines have seen the exposure that have been exposed to the vaccine. But here in Brazil, even though we have my age group will be vaccinated only in June.
wow.
Yeah, so they of course have the frontliners and the seniors, and I am 43, but my age group only by June will take the first shot. So that you may have an idea, Bishop Paiva, he passed on a Friday. On the Thursday, a day before, he went for his first shot. He was not feeling well, so they held him in the hospital, and he passed on the following day.
Wow.
So, and he didn't have the chance to take the second shot. So when we had his funeral, we discussed that we would hold Bishop Mariano in São Paulo because he didn't have the chance to take the first shot to be exposed to a large group of people in Rio. So this has been a big headache for us here.
Wow. And and this is and actually that leads into a little bit about what I was saying in my introduction.
Yeah.
So even those who have been vaccinated, you still are at risk. And then,
Yes.
those who have not been vaccinated, you have to make sure that you're protecting them somehow. And so I'm thankful that you all had the foresight to make sure that Bishop Mariano was taken care of. And
Yeah.
I'll just put that out there. Everybody here in the United States has not been vaccinated. All right.
Yes.
But isn't it something though? I will highlight this, First Lady Rona. You might want to say a little bit more. Isn't it something though that where we are in relation to what the other countries are doing as far as the vaccines that are available and how many people have been vaccinated? It's a little troublesome to me. I'll be honest with you. It just I hate to say it, but we in the United States can sometimes be so one so selfish. I'll use that word. I'll just be diplomatic. Just use that word. We have to make sure that we are looking out for our brothers and sisters, our neighbors, international countries. I don't know if you want to tag in on that, First Lady.
Well, wasn't Dr. Shepard even in the news recently that there were those that opposed the United States sharing some of
Yeah, they were right. That was.
and that is extremely selfish.
Yeah,
When you have people dying just
right.
in droves, but we want to hoard all of that information, that valuable life-saving information to ourselves.
Right.
And we say that we are a country that trusts in God. That is totally opposite of the characteristics of God.
Right. No, thank you for highlighting like that, because you think about Pastor. He says 43 years old. Here in the United States, we just allow for 12-year-olds to get the vaccine.
Yes.
12-year-olds, 12 to 15. They just approved that yesterday. Yeah, so actually now people are taking their high schoolers, their adolescents, to get vaccinated because they're hoping to be able to open up all schools come the fall with children. Actually, it's even to the point now here, and I want to ask this question. Here in the United States, they're saying that the college campuses can't open unless, or you can't attend the college campus unless you are vaccinated. Have they said anything like that, Bishop, regarding, I know you mentioned about your master's in divinity. Yeah, what have they said about the higher education, higher institutions of education?
Yes, thank you for bringing it up, Dr. Shepard. Actually, the Department of Education here in the Philippines, they were planning to have a face-to-face uh, classroom actually this year. But when they found out what happened what happened in South Korea when they opened
Ah,
classes face to face,
yeah.
the all most of the students were had a COVID, and not only that, because we have a church-based school here. It was Kojik Montessori
Mm-hmm.
school, and uh, it is under the private school here in Angeles City, and most of the private schools, they still don't want to have a face-to-face classroom for all the students
Mm.
unless the case of COVID will drop down or there will be a flat on the curve.
Mm-hmm.
And second is that most of the Filipinos had been vaccinated. And that being said, just to give you an idea, the total population of Philippines as of 2021 is 110 million,
Mm.
and only 0.5% of them got their first dose only.
Wow.
So it means only 2 million individuals have been vaccinated for first dose, and with 517,000 will receive their second dose. So if we will see on that statistics, it would be we are projecting at least 2 to 3 years before there will be a physical or I mean a face-to-face classroom here in the
Wow.
Philippines. And not only that, most of the parents, we had a survey, and most of the parents, they still don't want their children to attend the school. They still want to have an online class, which we are doing right now with our school.
Mhm. Wow. Oh man. Go ahead for a second.
Well, I was going to say, my son-in-law, Carl, he's a high school teacher for LA, Los Angeles Unified, and it's kind of similar there. It was on the LA Times this week that only 4% of high school students in LA Unified returned back after they were allowed. So
Mhm.
my son-in-law, who had been teaching from home, he was sent back to the classroom when it opened up, but then so few students came back. Now he's back at home teaching again. So the parents, depending on the location, they are not wanting their children to go back either. And there's so many factors that are involved there.
Yeah, and that really speaks to even the whole lifting of the indoor mask mandate, or just lifting of the statewide mask mandate, because people are not quick to change. I mean,
Mhm.
let me just tell you. I mean, and you know this, studying behavioral health, that we were traumatized.
Yeah.
I mean
Exactly.
that's the word. We were traumatized by what happened last year, and that we're still in it. You
Mhm.
know, and the fact that we can now just say, well, it's over, or that the mandate is, that's not how we deal with trauma.
No.
No, we have to be healed from trauma.
Yeah.
And many times it has to be a gradual healing,
Mhm.
step by step by step. Wow. And did you hear that? Only 0.5% of the people. I hope the listeners are hearing that. I didn't get a chance to reset the room like I normally do. I'm going to do it now. So thank you for commenting. I see Raynard Smith. Oh, man, wonderful. Who is known in Cogent for Cogent Scholars. And Rhonda continues to comment and chime in. But let me tell you, 0.5% of the people only vaccinated. Now,
Mm. So, Dr. Shepard,
That's
do you
mhm.
have any updates on now that the mask mandate has been lifted? What's going to happen at our Holy Convocation? I know they had said that if you were not vaccinated, you were not going to be allowed to attend. But now that the mask mandate has lifted, do you think there will be any change regarding Holy Convocation?
I don't know. I don't have. I'm not privy to be on that particular task force. I
Okay.
will say that there are some things I'm sure that they will consider. Just for those who are wondering, what is Holy Convocation? It is a gathering of people. It's our largest gathering of people for our particular denomination, a Pentecostal denomination, which all of us actually work in, and it is held typically in the United States of America. I say typically, it's held in the United States of America. It's been normally held in Memphis, our headquarters, but then we moved to St. Louis, and we are going to attempt to hold that gathering. I just think about how even for certain conferences that I'm supposed to go to this year, and it's been the topic of discussion. Are you going to go? Will you feel comfortable going? What would you do if this happened? And so those same questions will be asked about gatherings such as a Holy Convocation. It's already been stated that it's going to be capped at a certain amount. I did hear that. But regarding mask mandates, I think it's too early, because honestly, I see the coronavirus being just like the flu season, where
Yeah.
we're going to have ups and downs.
Mhm.
So, yeah, I really do think it's too early to really state. So I'll just kind of leave it alone as that.
Okay.
But time would tell. Time would tell. We're going to shift here, Pastor. We're talking about the vaccine. I want us to. 'Cause I'm looking at our time here. Um, what about the myths? We were talking a little bit about that earlier. What are some of the people down there in Brazil saying, who's like, well, this is not real, or let me just say this: are people down there saying that the coronavirus is not real? Because that is one of the major things that we're dealing with here in the United States of America, where people are saying that it's not real, it's made up, they're trying to control you. Are you hearing those type of things down there in Brazil?
Yes, yes, we have a group of people who are really for the denial, that really do not believe it's a real thing. And what we say here is that it's not real until it affects you or your family, and you
Yeah.
enter to the statistics, you know.
Right.
So we have many people that deny, even in the politics. We had some politicians that was at some point with our president saying things that had nothing to do with the reality, and they got sick themselves, and some of them passed away. So how come you deny a disease with such a level of lethality? So you cannot do that, and there is a group of people that is just expecting for leaders to say or conclude that it's not real, so they can be free, stop using their masks, stop washing their hands, and you can go out in a weekend like tonight here in Brazil, and you're gonna see a bunch of groups of people in the streets, or drinking or dancing their funk music, and to say how come these people will not understand that this thing is real and so many are being taken away.
Yeah. I do remember reports about the president of Brazil not taking seriously everything that was
Yes.
going on. I do remember some reports about that. Wow. Raynard Smith actually asked an important question, and we did talk about this in our preparation for the show. And let's just go ahead and dive right on in. Thank you, sir, for asking the question. He said, what are some ways in which we can support the people of Brazil financially and materially, to those who are faith believers, but honestly, just really to the people of Brazil? Because one of the things that we learn in missions work is that as you are kind to people, it actually draws them into the faith,
Yeah.
and that's an excellent way of evangelism. So what things can we do? If we want to start with you, Bishop Forto, and I'll be honest with you. Every time you say the Philippines is a third world country, that just bothers me. I'm not gonna lie, because I've been there, and I just don't think of it as a third world country. But it's just wow. Every time you say that, it's just kind of like, ugh. But I hear you. So just know that I have high respect, high regard for the people of the Philippines. But what things can we do materially and financially to support there?
Yes, thank you for asking that, Dr. Shepard. Uh, in terms of for the vaccine, of course, uh, we the process in getting those vaccines is from the government to government of of a certain country. So with the vaccines that we need, of course, we don't have that really have the great opportunity to have that. But right now, we are uh, having actually most of the uh, groups here in the Philippines and in Angeles City. They started uh, their own community pantry
Oh,
where they could put goods outside of their house, and they will just put a note that you just get what you need. If you need something, you just get what you need. If you want to donate something for others, something like that. So it's been a viral here in the Philippines where in your own way you could help your community, you could help your neighbors, especially for those really affected with the COVID-19, those who lost their jobs, who were, uh, I mean, suffers from financial uh, with what they have to supply to sustain them in a day. So it would be wonderful if, because we are planning here in our headquarters church to put a community pantry as well. We are actually talking to our leaders on how we could gather some funds, some donations, whatever donations that they could give, so we could put a community pantry in front of our headquarter church for us to be able to help our not only our members here but also our neighbors here in our headquarters. Just like one of the vision of the church is for us to be able to touch the community and to transform them and to be able to reach them through this with the word of God. And I believe that would be one of the things that we could ask if you could help us establish this community pantry for us to be able to add on what we have right now.
gotcha. So a community pantry, and we see that here in First Lady, how there have been so many people who have been looking for food. It's been amazing. I mean, sometimes I drive down the street on Sundays and there's a particular church that's handing out food. I can't even get around the line. And this is just literally about a month ago, just how many people are in need of food. Is it possible, Bishop, that people can text you through social media or send a message through social media? That way they can find out how to be able to send a donation to you. Can people do that?
Definitely, Dr. Shepard. They could connect with me to my Facebook account
Okay.
and send me a message, and we can talk on how they could be able to help the Philippines here.
And Dr.
Absolutely.
Dr. Shepard,
Yes.
I don't know if people are also aware of FEMA has been offering assistance for funeral costs, those dealing with the high cost of funerals. And so that's a resource that kind of later on in the pandemic was publicized. And we tried to share that information with some people, but so many had already struggled to bury their loved ones. And then later on, FEMA came out with, their resources that they're making available.
Yeah. And I got that letter. I'd heard about it from one of our sister churches, but then there was a letter that went out to actually the physicians through the Department of Public Health about these resources for anybody who has experienced death in their family.
Mm-hmm.
And let me tell you, it was so jam-packed, First Lady, that it shut the system down.
Yes.
I mean, it's scary, but let me think about it. We're talking about 500 and almost 90,000 deaths. I'm rounding it up now.
Yes.
and they're saying that if thank God the number of cases have gone down below 50,000. I think we're averaging about 35,000 cases per day yet. So imagine that, Bishop. We're still averaging 35,000 cases of coronaviruses of the coronavirus a day here in the U.S. That we could reach up to 600,000 by Memorial Day of deaths. 600,000 deaths, particularly by. Oh man, he dropped off too.
Yeah. Well, that's also been part of the problem, hasn't it? Every time a holiday would come up, there would be a spike.
Yeah, so I'm even thinking about that for Memorial Day.
Yeah.
So let's think about that. You just brought that. I hadn't thought about that. Ooh. The fact that now this would be the first holiday where we're actually now going to have people who may not have a mask on indoors.
Mm-hmm.
Yeah, and let me tell you, epidemiologists have already predicted that we're going to see some more spikes.
Yes.
Because we still got a ways to figure this thing out, which is why people were surprised that the CDC just decided to lift the mandate really just so quickly. I won't say haphazardly, but I know some out there would, but they just lifted it quickly and without really any type of warning. Yeah. So, stay tuned, you all, and we definitely will be covering that on Ask the Doctors.
And I specifically asked about the CDC as it relates to the convocation because many of our brethren from other countries, they look forward to coming, like Bishop Pastor Aeneas Francisco stated. That's where he runs into Bishop Forto, is at the convocation. And so that's a great time of fellowship and strengthening for our brothers that come in, sisters coming in from other countries.
You know what? You stepped on a landmine right there, First Lady. I'm just going. I'm not scared. I'm not scared to go there, but I can even see where some of our folks would be like, "Well, we can't have anybody from our international delegation coming in," and I sure hope that that's not the case. But I
do too.
I'm just going to be real. Because people are scared.
Yes.
And the purpose of today's show, truthfully, is to help relieve some of that anxiety and to also show how we need to reach out to our neighbors, let people know what's happening in other countries. So if you see us, somebody dropping off, we have to remember that these persons are in international countries, you all. We're talking about 12 hours away, 15 hours away from you. First Lady. So the internet capacity is not the best, not even the best here in the United States. So go ahead.
I wanted to ask a question to Bishop Forto. I know that in Canada, some of the pastors have been arrested for not closing their churches during this pandemic. I know Bishop Vincent Matthews, he was praying about this issue on the prayer this morning for our national church. Has there been any type of problem in the Philippines with churches being forced to close and pastors not wanting to comply?
Wow.
Thank you for bringing it up, Lady One. Actually, regarding with the church gathering here in the Philippines, we really don't have encountered some problems because we were, and this is from my point of view, and I'm just really proud I'm not just speaking for myself as pastor in our denomination, but I'm speaking for all the religious group. We actually obeyed what the government told us. If there's a need for not opening the church, just do the online worship celebration. And I believe that most of us here in the Philippines, because we just followed what the government told us to do, it is also for our own safety. They are not doing this because they don't want to have our gathering. They don't want for us to worship God, but they are doing this for our own sake. So as of now, we have no any news that pastors or priests or other religious group have been arrested for not following what the government had been uh, instructing us.
Mhm.
And the good thing is they will tell us that it just be a few Sundays that needs to be locked down, but after that we'll be able to resume at least starting from 10 to 30% of the total church population.
Mm.
And actually, I could say that it's a good thing here in the Philippines that most of us, that all of us, really followed the instructions of our national government.
Mm.
Wow. Yeah, I did not know that that people were actually getting arrested. And I know that here in the United States, they would fine
Yeah.
pastors.
Mm.
But yeah. Um, let's see. Thank you, Pastor Aeneas is back. And, yeah, he's back. He's back. He's back. Uh, so we're going to close on this end. I know that Raynard Smith is asking about the contact information. Bishop, if you don't mind, I'm going to give him your email address. Can I do that?
Yes, you can
Okay.
do that.
All right.
It would be
Okay.
great, Dr. Shepherd.
Okay, great. So that's what I'll do. Pastor Aeneas, while you're responding, I'll just put that email address out. How can the people be of help to Brazil, material wise, financially, beyond just the vaccines? We know that people need the vaccines, but if there's something that people can do, Bishop Forto mentioned about the community pantry. Is there something that we can do to be a help? You're muted, Pastor.
Okay, so I'm sorry.
Yep, there you go.
First, thank you for asking. I do believe that at this moment, most of what we know as third world country faces a lot of negative impact financially, economically. So at this moment, we've seen so many churches who closed down, even our own church, some of them closed due to the effect of COVID on the finances of the church. So most of the members losing their jobs, and they don't know how to take care of their own. So the pastors end up having a load, a bigger load on themselves because they need to think about themselves, their families, and find ways and strategies to stretch their hands in order to help the members of the church. And some areas in the country that is like more distant from the capitals or large cities, they are impacted even more. So I believe there are two things that could be done or can be done. I believe that conversations like these with leaders in order to listen to them and hear their needs, and I mean emotional needs as well, because sometimes it's just too much for a pastor or a church leader to handle all of these by himself. So conversations um, after the because the after effects of so many funerals, it's always a good thing. And of course, if we have the possibility of churches that could partners with churches here that could help, in creating pantries like Bishop Forto is sharing, helping the local communities the local churches to stretch their hands and bless the community, that would be a great thing of the church serving the needed.
Absolutely. So what I'm doing is I'm just putting up the email addresses of Bishop Forto and then of Pastor Francisco. All right.
Thank you, sir.
That way you can reach out to them directly, and we'll make sure that that is legit. All right. We'll make sure that nobody is taking advantage of anybody. If you don't mind, I think Pastor Francisco, just mute yourself. I think I'm hearing an echo. Just real quick. Yeah, there we go. Yeah. Okay. So with that said, we're getting ready to wrap up. This has been tremendous. You said something, Pastor Aeneas, that really I don't think people really caught. I said really twice. I don't think people caught it. Discussions like this help when you're going through emotional turmoil. I'm putting it in my own words. So when you are facing hit after hit, death after death, loss after loss, sometimes just being that listening ear. And I'm thankful that this particular broadcast hopefully could provide that for you. Our hearts are heavy because of the people who have died. Several people have died here in the United States of America. We talked about that, Brazil, in the Philippines. I am curious. I do have this one question before we go. It just came to me. The Olympics are supposed to occur in the Far East. First, you just see her face, and your face is like, oh, I don't know about that. Bishop, have they talked about anything about? I know Japan has been experiencing an outbreak. That's what I'm hearing, and I know that Japan, Philippines is not that far from each other. Yeah. Any thoughts about the Olympics occurring? And I'm going to post the contact information again.
Yeah, actually, to be honest, I really don't have any idea about the upcoming Olympics. But what I know is that every time that there's an Olympic on the Southeast Asian Games, they've been broadcasting on air that our athletes is now preparing for the upcoming events. But now I don't have any news on any athletes, our own athletes that started training as early as now. So it means that they are silent. So it means that I don't know if they'll be able to participate or what, you know.
Gotcha. Okay. I just had to ask that question there to see if you had any inside scoop. I was just curious as to what's happening over there or in the Far East, in the Far East, because I'm hearing that people are scared, and that's one of the reasons why I mentioned about, we have to deal with the reality of people wondering if someone's coming in from an international country, how do we handle that, and that's a fair enough question, because sometimes there are variants that are passed on just because you're traveling. You may not even have COVID, but because you have to make a stop in London, you had to make a stop in Johannesburg, the different major ports, when we travel overseas, there's no direct flight from Baltimore to Mozambique.
Mm.
It takes.
And Dr. Shepard, as you mentioned, Mozambique, you have to stop in South Africa. And
Right.
there's so many variants of COVID right there in South Africa that puts a damper on it. Mm.
Yeah, absolutely. It took 2 days for me to travel. I traveled on a Sunday. We got to Mozambique on Tuesday.
Yes.
We go to the Philippines. It takes 2 days. We left on a Sunday. It was Tuesday by the time we got there. And so these type of things, and they're talking about you have to wear a mask on the airplane. Can you see myself wear a mask for a 16-hour flight?
Ooh. Double mask.
I mean, so all these things are just, we have to think about that. And again, we don't want to miss out on our brothers and sisters in neighboring, our neighbor international countries. It's just, this is things that we got to really think about. And this hopefully discussion today will hopefully open up somebody's mind, open up somebody's thoughts to say, hey, I need to be thinking about my brother, my sister. How can I be a help? It's not just about us in the United States of America. It's not just about us in Brazil. It's not just about us in the Philippines. We're all in this together. And as we're all in this together, we want to come out together and want to come out together on top. All right. Let me just stop right here. We're ready to close out. Bishop, are there any parting words, anything you want to say to the people as we close out the broadcast?
Yes, thank you. Again, I just want to thank you, Dr. Shepard, for this wonderful opportunity to have me, and of course with my brother Pastor Ernest from Brazil, to hear our voices outside US, and we're able to know the real situation of the Philippines and as well as in Brazil. And I just want also to thank Lady Juan. I just love the whole family of Bishop Juan, and we really miss them here in the Philippines. I just want to if you will allow me, I just want to encourage everyone that we need to lock down our faith. We need to continue to hold on to our faith in God during this pandemic. So let me just say 4 words before I just before this program ends. The word lock, it's LOCK. L is we need to lean on God's words and promises. God's words are true. They will give us strength. God's promises will surely come to pass. And in the word lockdown, we need to omit all the negative thoughts. We need to marinate our mind with the words, with the promises, with the love, with the grace of God for us to be able to overcome all those emotional stress that we encounter during this pandemic. And see, we need to always create an atmosphere of worship. You know, even though that we are surrounded, we don't know where the virus will be at. It's outside your door, outside the church door. But I believe as we create an atmosphere of worship, the presence of God will continue to protect us wherever we are, wherever we go. And last is letter K. We need to know that God is still in control of everything, even this pandemic. So I just want to encourage this. We need to hold on to our faith. We need to lock down our faith in God, that no matter what, it will not be shaken, it will not be altered, because God is in control of everything. Thank you so much, Dr. Ron and First Lady Ron, and to my brother, Pastor Agnes.
Oh man, I was writing because I had to get that. I want to use that. I will let you know. That will be used here in the United States of America. So if you hear that again, LOCK, I'm going to put that out for people to lock on to your faith. Oh, that was good. That was good. All right, Pastor Aeneas, what are some of your parting words?
Well, I want to thank you for extending your right hand and receiving us in your platform. And I thank God for the life of our First Lady. We miss her so much here, and we can't wait for this thing to pass away so we can see our leaders here in Brazilian territory. Bishop Forto, is always good to see you, and can't wait for the next convocation when we can really get together as we always do. And I just would like to encourage the people to love. We've been learning so many lessons on the importance of loving now, not loving tomorrow. We must love now. We have some people around today that we may not have them tomorrow. And just for you to think a little bit on this, as Bishop Piper was a close friend of mine, and I always called him for so many things. And this past week, I found myself trying to call him in order to say that I'm taking over Pastor Alexander's church. So, because we've been so connected. So you need to take advantage of the fact people are with you now and love them now. Don't love tomorrow.
Wow. This is deep. First Lady, I want to give you the last words for being a guest. Thank you so much.
Okay.
Pleasure.
I think Pastor Nelson needs to mute again. Are you hearing that?
I'm sorry.
Okay. Amen. And this has just been wonderful. And I feel like I'm just with my family, like at Christmas or something. I just love everyone on this dialogue. And I think in loving now, I think we need to love and appreciate the gift of Dr. Shepherd. You can get weekly encouragement through the different lives that he has, things that are promoting our mental health, which is so crucial right now. When Pastor Alessandro Mariano passed away, I was asking his sister, Denise, Evangelist Denise, how she was doing. And she said, "We are crying, but the joy of the Lord is our strength." And Evangelist Denise is a very strong, powerful woman of God. But some individuals we find in this time of sorrow, they're coming closer to God during this pandemic. Some are coming closer to God while others are going far away. And we must maintain a watchful eye. Because the devil, he's going to try to take advantage of every opportunity. So keep an extra watch over your flock for those that may be kind of drifting. And what we are finding that we may have to do some new things that we have not done before. We may have to create some grief support groups. We know in many of the other non-Kojic churches, that's a common thing. But we're finding that many of our friends who have lost loved ones to COVID, they have latched on to some other grief support groups outside of Kojic. But we may need to begin developing grief support groups within our local churches as well. It is so essential. I know Mother Barbara McCullouis, she has a grief support prayer line that you can call into. But we have to understand, back in the day, they would just say, "Baby, just pray about it." And that's always good. But we must always be improving our reach and meeting the people where they are in terms of this grief process.
I like what you said, improve our reach. Improve our reach. I'm going to be taking that also. This has been wonderful. We're going to bring this broadcast to a close. I just want to reiterate Hope Health Systems, which is the employer who sponsors me for this particular hour. It's where I work, and I'm so thankful for the latitude to be able to explore such rich discussions with people who, such as yourselves, are really adding. I got called by Pastor Aeneas with text. He said, "I'm not a doctor," because the graphic said doctor, and I said that's okay, because there's some people out there who call themselves doctor or have these honorary degrees and they're not even doctors. But let me tell you, it takes a doctor to know a doctor, and I am a bona fide doctor, and I have no problem calling you all that, because you all are doing the work. And doctors are not just ones who have a title, but they're ones who provide the assistance and the relief that is needed when people are ailing. All right. And yes, there are different types of doctors, but I'm talking about those who are physicians for the soul. And that's how I see you all. You are physicians for the soul. You are physicians who are concerned about community. So that's why they have a problem utilizing that title. We did make the change, but just want to let you all know that I do highly respect all three of you all in your respective places. Hope Health Systems is a large mental health organization located here where I am in Baltimore, Maryland, and we do serve throughout the state of Maryland. We also are global. I wanted to have our program director come on. She was unable to do that, but we're global. We actually have sites throughout the globe, and we are reaching over into the continents of Africa, various Caribbean islands, and sites where I don't even really know so much at times, because there's just so much that our company is just concerned about with mental health. This is Mental Health Awareness Month.
Yeah.
And because it is Mental Health Awareness Month, I thought it would be very apropos that we talked about what's happening outside of the United States, because mental health it deals with 4 points, and I'm done. Your potential, your ability to cope with stressors, your ability to work, and the contribution. Wow, isn't that something? We talked about all those things today. We talked about your potential. We talked about how we're coping with the stressors, the death and loss. We talked about working productively and fruitfully, but then the most important, make a contribution to your community. And so hopefully today you've got the contact information so you can reach out, be a contributor to the various communities in these countries. Thank you so much, panelists. Please hold on. I want to go ahead and end the show, but I want to just debrief with you all. Thank you all again. I'll see you all next week. We're going to continue with Mental Health Awareness Month here. I got some exciting things for you all. Wow, we have somebody already who's in Saturday, Saturday, May 15th. That's just blowing my mind. Everything's going to be all right. You're worried about what you're going in right now, but Bishop Forto is already ahead of where you're going to be at, and he looks pretty good. So
I'll see you in the future.
Yeah, I keep messing with that, but I love that. I love that. All right, take care, you all. Have a safe weekend.
Bye-bye.